Understanding of holistic healthcare, prevention and management, understanding the comprehensive basis of healthy living, knowing national policies on safe health, how to use the available resources at a spot in times of sudden illness, promoting good healthy living habits, promoting good healthy living environment. Join our Health Talk live on Super TV, Channel 10 with your host, Jarausi Joe.
Okay, pleasant. Welcome to our health. This is a 30-minute television program that brings you live coverage on health issues. We explain basically on those issues concerning our health. And today we have with us our important guest. So let me bring my guest in, and then I will do a formal introduction of my guest before we can go through. So let me do the formal introduction. There's welcome, Professor. Welcome.
Thank you.
Okay,
Very nice to be here.
okay. This is Professor Salim Abdool Karim. Am I correct, sir?
Correct.
Okay, he's the director for Central for the AIDS program of research in South Africa. Professor Salim Abdool Karim is a South African clinical infectious diseases epidemiologist, widely recognized for scientific and leadership contributions in AIDS and COVID-19. He is the director of the Central for the AIDS program of research in South Africa. That's the CAPRASA. Uh, also a professor of global health at the Columbia University in New York. He previously served as a president of the South African Medical Research Council. He is a member of the Science Council of the World Organization and the WHO TB HIV Task Force. He is chair of the WHO Strategic and Technical Advisory Committee on HIV and hepatitis, right? Okay. He is a member of the Africa Task Force for Coronavirus, the African Union Commission on COVID-19, and the Lancet Commission on COVID-19. So, welcome, Professor Salim Abdool Karim. Welcome,
Thank
sir.
you very much. Great pleasure to be here with you.
It's a pleasure to also having you as my guest on this show. So, let's go basically directly into our interview. So, sir, from from what I read, concerning your profile, you serve as member of the Africa Task Force for Coronavirus. So, can you basically give us the overview analysis of COVID-19 infect in Africa, sir?
Well, when we look at COVID-19, we need to look at the cases, the admissions, and the hospitalizations. And when we assess the impact of COVID-19 in Africa, what we find is that we've had fewer reported cases than other parts of the world. We've also had fewer reported admissions and deaths. But when you look at the excess deaths, we get some idea that Africa has been impacted at a similar level to the rest of the world. And indeed, it's some of our early actions taken by governments that slowed the initial spread of the virus. But since then, the virus, through all its different variants, has continued to spread. And it's very promising that you have researchers in parts of Southern Africa and Botswana and South Africa that have been instrumental in describing the new variant, Omicron. It gives you just some idea of the quality of the science that we have in our continent. And it gives some idea of the way in which we have established surveillance systems to identify new variants. So I think all of this bodes well for our ongoing efforts to stem the tide against the coronavirus. And I think as we go forward, we will be looking particularly at the public health conference coming up next week. We're going to be looking at, how can we ratchet up our vaccinations? How do we do better in slowing down the spread of COVID-19?
Okay, Professor, you make mention of the impacts so far. So, how can the impacts caused by COVID-19 be addressed, basically?
The impact really is at several levels. We have an impact at a clinical level where we're seeing patients and they're getting sick and we're dying. Then
Mhm,
we're dealing with the mental health impacts of COVID-19, the isolation, the fact that
mhm,
you can't even embrace somebody, you can't hug people. All of
mhm,
those things have a definite impact on our psyche, on the way in which we look at the world. So
mhm,
we are dealing with that impact as well. Then we're dealing with the economic impact, the business impact. We're dealing with the impact on just all aspects of our life. I
mhm,
think for me, the big issue is that we need to ensure that we can come out of this and recover from COVID-19 economically. Because if we don't, then our future will just take all that much longer to get back onto the way things were and trying to rebuild our economies and rebuild our societies. And I think that that's what we've got to put our energies into.
Okay, so let's look at the vaccination aspect of this COVID-19. So, how effective and affordable and trusted are vaccines being distributed to low-income country? That means countries that are underdeveloped or in a development stage.
Yeah, I mean, we now know that the vaccines are indeed very safe. They've been given to billions of people. We
Mhm,
also know that they are quite effective in preventing transmission of the virus and preventing death and hospitalization.
mhm,
Now, different variants have had an impact on the efficacy of our vaccines, and some of
mhm,
them have had more breakthrough infections than others. But essentially, the ability to prevent severe disease is one of those things that the vaccines do very well in. And it doesn't matter which vaccine we're talking about, they all do pretty well in preventing hospitalization and death. Overall, the vaccine coverage in Africa
mhm,
is too low. We have to do better in terms of raising our vaccination uptake. Part of the problem was, we got vaccines quite late
mhm,
because the wealthy countries purchased the vaccines and stockpiled them, and we had to go to the back of the queue and wait for vaccines to become available. Now the vaccines are available. COVAX, which is a major supplier of vaccines in South Africa, has been providing our continent with vaccines, and so too the African Union's Vaccine Acquisition Task Force has been distributing vaccines across the continent. But we also recognize that vaccines are arriving in the midst of healthcare systems that are often underdeveloped. And so we have to look to supporting one another and supporting each other in assisting countries with low vaccination coverage to try and improve their efforts and trying to improve their vaccine coverage. Because until we do that, it'll be very hard to go back to some sense of normality.
Okay, recently there was a report from Nairobi, Kenya, and the Ambrif Health Africa, they launched a program called Vaccine Injustice in Africa, and they are saying that the population in Africa, like 7% of the population in Africa, had not yet 7% of the population in Africa have been vaccinated. So as compared to the Western world, that's the European Union, like about they say 70% of the European Union's populations have been vaccinated. So there's an injustice saying that because Africa, there are low income countries in Africa, so that means all of the vaccine cannot be able to reach in Africa for half of the population in Africa to be vaccinated. So can you address that?
Yeah, I think we have seen this real problem that while science has been able to provide the world with a vaccine, politics has failed us in being able to distribute that vaccine in an equitable way. So we have gross vaccine inequity. And part of the vaccine inequity is that we have many countries with low vaccine coverage. I mean, right now, at a global level, just over half of the entire world has been vaccinated. But in Africa, we are barely at about 7% vaccine coverage. So we've got a long way to go to meet up with what is the global mean in terms of vaccine coverage. Now, getting vaccines is one thing. Being able to convert vials of vaccines into jabs in arms is a second challenge. But we also have to deal with the challenge of misinformation and all of the conspiracy theories and so on. And that's part of public health. Public health is about trying to provide honest, scientific information in a way that can improve the health of people. And we hope that, many opportunities that we have will enable us to put forward, proper scientific information on vaccines so that the misinformation can be, set aside.
Oh, so you're talking about the misinformation of vaccine. So, what the monitoring policies have the African Center for Disease Control instituted in order to ensure the decentralizations of vaccine, especially in undeveloped countries, be can you?
Yes, so the African CDC is the secretariat for the African Vaccine Acquisition Task Force. And that task force has been given the job of going and finding vaccines and making them available in Africa. And they've been doing a pretty good job. They have been going to various companies to secure doses of the vaccine. And once they get them, they distribute them. They provide support with the cold chain that's required in many of the vaccines. But also they provide technical assistance. They help countries that are trying to improve their vaccine coverage. They help them in monitoring the vaccine uptake and establishing systems for certification so we know who's vaccinated and who's not vaccinated. And establishing all of these as secure information systems has many challenges, but monitoring it is part and parcel of its implementation.
Okay, so now, what role is the ACDC, that's the African Center for Disease Control, playing in helping countries with weak health systems revamp their health sectors and adequately build their capacities of health workers, which will prepare them for future outbreaks?
Well, we're very fortunate in that in Africa, we have centers for disease control and prevention because, until recently, until about 3-4 years ago, we didn't have one. And the fact that this was created is a testimony to good leadership because they saw the future need to have some kind of center to coordinate the response to infectious diseases in the continent as a whole. So the Center for Disease Control plays a critically important role. Not only does it establish the systems of information, collecting all the critical pieces of information so that we have a perspective of what the pandemic is like in Africa, monitoring the number of cases and deaths and so on. But it goes beyond that. Because the CDC, the African CDC, is not just about data collection. They have teams of scientists, clinicians, and public health practitioners that can assist individual countries. So recently, for example, Eswatini was having some challenges in increasing its vaccine coverage. The African CDC sent a team to Eswatini to help them understand how do you build demand for vaccines, how do you improve access to vaccines, how do you monitor the uptake of vaccines. So all of those issues come from a team with a lot of experience in how to roll out vaccines. And that's an important coordinating task. It's an important individual country support task. And I think that as we look at the importance of the African CDC, we have a lot to thank for in its current director. The founding director of the African CDC is Dr. John Nkengasong, a Cameroonian. And he has done a superb job, because what he has done is that he's taken the elements of good governance, the elements of technical expertise, and the elements of pandemic response, and he's brought them all together in a way that enables the continent to respond better than it could have without the Africa CDC.
Okay. Is there, sir? Are you getting me, sir?
Yeah, I can hear you.
Okay, so is there a disparity in immunizations between developing and developed countries?
Yes, I think we've been seeing that now. The disparity has been getting steadily worse from when it started back in January of this year. Africa was late in getting vaccines. Some countries like Egypt and Morocco got vaccines quite early. They got this through vaccine diplomacy, largely from China and to some extent from Russia. But the actual flow of vaccines at a level that would be meaningful in Africa only really took off in around June of this year. So vaccination programs on our continent are barely 6 months old. And in these last 6 months, what we've been doing is trying to address the fundamental inequity in vaccines between wealthy countries and the poor countries. And how we do that has been our challenge, because on the one hand, we have the advocacy tools and so on. On the other hand, we need to convince drug companies to make vaccines available to us. Because in a very odd situation, one of our most important weapons against COVID-19 is actually something that, in the form of vaccines, that is under the control of private pharmaceutical companies. And that's very unfortunate, because then it's based on those who can pay who will get vaccines first, and those who can't will have to just simply join the end of the queue.
So now you make mention previously, of politics. Yeah, so how has our global politics steered the working of the ACDC, and what role did global politics also play, which led to the rapid spread of this COVID-19?
I mean, many aspects of vaccine inequity are really fundamentally political. They are political decisions about who should be prioritized and how Africa should have to deal with its challenges. Now, as we think about COVID-19 and the way it has spread, there have been many political decisions that have impacted. I mean, just for a moment, reflect on a situation where last year, I think it was around March, April, we had President of the United States withdraw the US from the World Health Organization. So how can we expect the World Health Organization to deploy its resources in order to control this pandemic when a major partner and funder has chosen to withdraw. I think that's part of the problem we're grappling with, that we're dealing with these legacy problems. Now that the US has been fully supportive of the WHO, the next step is to ensure that the WHO is well funded so that it can undertake its mandate of ensuring that we are dealing with this pandemic in a scientifically rigorous way, that we are following the science, we are doing what is appropriate, and we are doing so in a way that can really make a difference.
Let me drive you a bit. Recently, there was a report from South Africa concerning the recent outbreak of the COVID Omicron variant. Can you give a clarity on that, sir?
Sure. So the first case of Omicron was reported by Botswana. It was on the 11th of November. A few days later, a second case was uploaded onto GISAID, the international database, from Hong Kong. And then shortly thereafter, several cases were added from South Africa. What we have seen with Omicron is a new variant that has many different mutations, over 50 mutations. So it certainly has a lot of mutations to deal with. And those mutations, when you look at the fact that they come but they are the same mutations, so they share these same mutations with the mutations in the alpha variant, the beta variant, the gamma variant, and the delta variant. So this new variant has mutations that have been beneficial to all of those four variants of concern. And so we've been expecting that Omicron will transmit faster, it will spread faster, and it's likely that it will have some level of immune escape, that it will be able to bypass our immunity. So far, the early data we have certainly suggests that this particular virus, this variant, is spreading very rapidly, extremely rapidly. And as we deal with its rapid growth, it presents itself as a huge problem. I think as you've sort of highlighted, that variants can be created anywhere in the world, but their impact is felt by those countries that report them, as South Africa has learned, much to its detriment. I think that Omicron is a variant that is a pause for us to think about how we tackle with COVID-19. How do we use our vaccines, our public health measures, we use all of those tools that we have to keep this virus at bay?
So is it the same public health measure that we were applying for COVID-19? Is this the same one we will be applying for this new Omicron?
Yeah, I think so. So Omicron is COVID-19. It presents like COVID-19. It's transmitted like COVID-19. So what we were worried about is, did the mutations change the virus to such a significant extent that our vaccines would be useless? Now, we don't know the full answer to that, but certainly at this stage, it does not suggest that that's the case. In fact, that vaccines can provide protection, especially protection against severe disease. So Omicron has been a wake-up call to all of us to say, don't forget that you have to wear your mask. don't forget you have to maintain social distancing. Don't forget you need to do as much as you can outdoors, because all of those are important in addition to vaccine. That as we think about new variants, we have to be better prepared for them. And one of the ways to be better prepared is to have good surveillance in place, but also to ensure that you follow public health measures.
So, for this Omicron, that brings a new sign or symptom as compared to COVID-19? Is it different or they are the same in terms of symptoms?
So the symptoms we have been seeing with patients who have the Omicron variant, the symptoms have generally been milder. We still see severe cases, but they are a handful, and much less so than what we dealt with in the previous waves. So in many ways, the virus itself seems to have become a virus that is more transmissible, more infectious, but it is less virulent. It's causing less severe disease. And that's more or less how we expect viruses to evolve. We expect them to evolve with lower ability to cause severe disease. And there's good reason for that. Viruses have to adapt. And in adapting, they have to figure out what gives them best advantage. And the best advantage is to have a situation where you're dealing with the pandemic, with human rights, with all of your measures together at the same time.
Okay, so you people are saying that your World Health Organization need to provide another dose when it comes to this prevention of the Omicron virus, and we found out that half of the population in Africa haven't yet received all of the doses that as relate to COVID-19. So how ACDC gonna work on that?
Yeah, so there's been a lot of talk about giving another dose of the vaccine, and there have been calls to do that across the world. In fact, the US has made a third dose of vaccine widely available. So too has Israel. Other countries, third doses have been made at a more restricted level, focusing largely on the elderly and the immunocompromised. I think we just don't have any data to suggest that booster doses would be any particular advantage in this particular variant. It is information we just don't have. We don't know whether vaccines would be more effective if we had an extra third dose, or how any of that would make a difference to this. There is some that have been recommending a third dose, especially the companies that make the vaccines have been recommending that. But I think it's too early days to argue that we need a third dose until there's more data to suggest that it makes a real difference.
Okay, before I take leave of you, there will be a conference, if I'm correct, there will be a conference that will be held from the 14th to the 16th of December on International Conference on Public Health, and I show ACDC is part of it.
Yeah.
So
go ahead.
Yeah. So and I'm sure ACDC is part of it. So
yeah.
how are you people gonna work on all of this?
The Public Health Conference is a major milestone for Africa. It's an opportunity for many of the continent's best scientists to come together, to share ideas, to share with the public what we know about many of our public health challenges. For me, it's a milestone. It's a milestone because we have not had an organization like the Africa CDC before that could lead us as a continent in the way in which we apply the principles of public health to improve the state of the continent, state of health on the continent. This is an opportunity to share that. There will be very strong political commitment expressed. There will be great science that will be outlined. And after this conference, it's an opportunity for all of us to take those lessons and look at how we can apply them in policy and in practice. And I think if this conference even leads to one significant policy change that helps save lives, then we've done our job. You are muted.
Are you getting me?
Yes, now I can hear you.
Okay. So, Professor Salim Abdool Karim, it's an honor having you on the show, anyways. So, is there something that you want to elaborate on that I didn't ask you?
No, I think it's when you're dealing with a pandemic, we can only really succeed if we stand together. If we use all our resources as a continent, as a world, to stand together. We need to be fighting not each other, but we should be fighting the virus. We should stand together to fight the virus because together we have a much better prospect of winning the battle.
So, thank you, sir. We hope on having you on the show another time right after the conference, so that you can at least tell us what have you people put in place, which going to help us eradicate this virus.
It's an absolute pleasure. Thank you very much.
Okay, welcome, sir. So, thank you very much.
Bye.
Bye. Okay, so folks, that was the voice of Professor Salim Abdool Karim. He's the director for the director for Central for AIDS program of research in South Africa, and it was a pleasure having him on the show. And he explained a lot concerning the COVID-19 and the newly outbreak of the COVID Omicron virus, which is now spreading in parts of. Have yourself a wonderful time and keep listening to this show.
Did you know that every minute of your life counts? Did you know about 90% of our people are ignorant about issues concerning their health? Join the program, Our Health, for better understanding on holistic healthcare, prevention and management, understanding the comprehensive basis of healthy living, knowing national policies on safe health, how to use the available resources at a spot in times of sudden illness, promoting good healthy living habits, promoting good healthy living environment. Join Our Health Talk live on Super TV, Channel 10 with your host, Jarausi Joe.
The subject is a subject very